We mentioned one of Nancy Pelosi's biggest, greatest hits. You got to pass the ACA to find out what's in it. Well, the Affordable Care Act, which made healthcare entirely unaffordable to so many people. Interestingly enough, premiums at the ACA could jump over 300% if there are not enhanced government tax subsidy credits. Now, there's a lot to get to here. There's a story out of ABC talking about all of the different things. What they're trying to do is talk about, well, the government shutdown. If they don't do this, then people on the Affordable Care Act or Obamacare. I should stop calling it the Affordable Care Act. Libs, interestingly enough, libs call it the Affordable Care Act. Conservatives call it Obamacare in print media. That's just something that I've noticed. And so when I'm reading lib articles who talk about it, they call it ACA. When I should just translate that into my head as Obamacare, because again, the idea that it's the Affordable Care Act is hilarious, kind of like the Inflation Reduction Act, which made inflation substantially worse. Anyways, all that to be said is that they're trying to push this idea that if the government doesn't step in and end the shutdown, that premiums on the Affordable Care Act are going to go through the roof. And that might be the case, but I think we should all recognize and understand how the Affordable Care Act made healthcare so unaffordable for so many Americans. I don't want to get too in the weeds here, but I do think this is important to understand, or at least reiterate if you don't already know this. The government, through Medicare and the Affordable Care Act and all that sort of stuff, negotiates prices with hospitals. So if you have a healthcare provider, that healthcare provider says, hey, to the government, you're going to pay us this amount of money for this particular service. Now, here's the kicker. The government does not pay the full freight. If the cost of something is $100, and good luck finding a medical procedure that's costs $100, but let's use round numbers. If a medical procedure costs $100, the government will pay on average substantially less than that, sometimes up to half of what it actually costs. So the Affordable Care Act does not pay the provider the actual rate that the provider needs to make to be whole. That being said, they have to make up the cost elsewhere. So that comes to the private insurers. All of those private insurers then are subsidizing the lack of payment by the government. In other words, if the government pays 5 cents on the dollar, you and me are going to pay $1.50, $1.75 on the dollar for the same exact service, because the government does not pay the full freight as negotiated by Obamacare. For all hospital services, interestingly enough, the private insurers pay about 2.5 times, 254% the Medicare rate based on 2022 data from a RAND report. Inpatient hospital servers, private insurance pays on average 189% of the Medicaid rate. For outpatient hospital services, the private insurers pay on average around 264% of the Medicare rate. For physician services, private insurance pays about 143% of the Medicare rates. So, with all of this talk that you're about to see about, well, the government shutdown is going to affect Obamacare and the 24 million people on that marketplace, which, again, I don't want to neglect those people, because I don't want to neglect any American just because of, whatever circumstances they find themselves in. But also, it's not a huge percent of the population to have to bend the entire will of the government towards, because you're going to be seeing a bunch of stuff about this. And, oh no, what are we going to do with Obamacare because the government shutdown isn't putting the new subsidies in and the premiums are increasing. Remember this: because the government, through Obamacare and through Medicaid, does not pay the full freight, you, who are on your own private insurance, have to subsidize that rate. And because you have to subsidize that rate, your insurance premiums have gone through the roof. I'm feeling it in my family. I'm sure you're feeling it in your family. The expense of this is unbelievable. Not to get, I refuse to go on this whole other tangent, but when President Trump ran in 2016 on repeal and replace, I never quite understood why the replace component was ever necessary. We had a system, and it wasn't perfect because no system ever will be perfect, but it was a heck of a lot better than what we have now. And for some reason, it's continuing to be used as a bludgeoning blunt force object to hit conservatives when in reality it has damaged the livelihoods of pretty much everybody who has to deal with the healthcare system in this country, which of course then is everyone. So that being said, adios Nancy Pelosi. Pass the bill to find out what's in it, and we're unfortunately all finding out together. Well, all of the things that libs are going to say about this in the coming weeks and the coming months as the open enrollment starts. It's good for you to know the totality of government being involved in healthcare in order to make an appropriate decision when it does come time to vote on all of this stuff.